Hello and welcome. Today we're delving into a rare and often overlooked manifestation of a systemic disease of bladder sarcoidosis. This video will explore its causes, symptoms, diagnosis, and management, shedding light on this unusual condition. Sarcoidosis, in general, is a disease of unknown etiology. That means we don't fully understand what causes it. It's believed to be triggered by an abnormal immune response to an unknown substance. While genetics and environmental factors might play a role, the specific trigger that leads to sarcoidosis affecting the bladder remains elusive. It's important to remember that sarcoidosis is not contagious. In sarcoidosis, immune cells clump together forming granulomas. These granulomas are small collections of inflammatory cells. When sarcoidosis affects the bladder, these granulomas infiltrate the bladder wall. This infiltration can disrupt the normal structure and function of the bladder, leading to a variety of symptoms. The granulomas can cause thickening and stiffening of the bladder wall, reducing its capacity and affecting its ability to properly contract and relax. Bladder sarcoidosis is a relatively rare condition, even within the broader spectrum of sarcoidosis cases. Sarcoidosis most commonly affects the lungs and lymph nodes. Bladder involvement is estimated to occur in less than 1% of sarcoidosis patients. Because it's rare, accurate epidemiological data is limited. It can affect people of all ages, race, and sexes, but it tends to be diagnosed more often in adults between 20 and 40 years old and is more common in African Americans. The signs and symptoms of bladder sarcoidosis can vary depending on the extent of bladder involvement. Some common symptoms include frequent urination, a strong and sudden urge to urinate, urgency, painful urination, dysuria, blood in the urine, hematuria, and lower abdominal pain. In some cases, the condition may be asymptomatic and only discovered during investigations for other reasons. Diagnosing bladder sarcoidosis can be challenging due to its rarity and the non-specific nature of its symptoms. The diagnostic process typically involves a combination of methods. A thorough medical history and physical examination are crucial. Urinalysis may reveal blood or inflammatory cells. Cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and can help identify any abnormalities. A biopsy of the bladder wall is often performed to confirm the presence of granulomas and rule out other conditions, such as bladder cancer. Chest X-rays or CT scans may also be performed to look for sarcoidosis in other parts of the body. Bladder sarcoidosis is not typically classified into distinct types, but rather graded based on the extent and severity of bladder involvement observed during cystoscopy and biopsy. The degree of inflammation, the size and location of granulomas, and the impact on bladder function are all factors considered in assessing the severity of the condition. The treatment and management of bladder sarcoidosis aim to reduce inflammation, relieve symptoms, and prevent complications. Corticosteroids such as prednisone are often the first-line treatment to suppress the immune system and reduce granuloma formation. Immunosuppressant drugs, like methotrexate or azathioprine, may be used if corticosteroids are ineffective or cause intolerable side effects. Symptomatic treatments, such as medications to manage overactive bladder or pain relievers, may be prescribed as needed. In rare cases, surgery may be necessary to remove scar tissue or address bladder dysfunction. Currently, there is no known way to prevent sarcoidosis. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can help support overall immune system function. Early detection and treatment of sarcoidosis may help prevent or minimize its spread to other organs, including the bladder. The prognosis for bladder sarcoidosis varies depending on the severity of the condition and the response to treatment. In many cases, symptoms can be effectively managed with medication, leading to an improved quality of life. However, some individuals may experience persistent symptoms or complications, such as bladder dysfunction or recurrent urinary tract infections. Recent research focuses on understanding the underlying mechanisms of sarcoidosis and developing more targeted therapies. This includes exploring novel immunomodulatory agents and investigating the role of genetics and environmental factors in disease development. Ongoing research holds promise for improving the diagnosis, treatment, and long-term outcomes for individuals with bladder sarcoidosis.